the roll, please.
Commissioner Look.
Here.
Commissioner Brastad. Here. Commissioner West. Here. Commissioner Schulte. Here. Commissioner Meisner.
Here.
Commissioner Gamache.
Here.
Commissioner Reiner.
Here.
And the next item on our agenda is to consider accepting the regular claims paid over $500 for the period ending February 28th of 2020 and purchase card claims paid for the period ending February 28th of 2020. Is there a motion to approve?
So moved.
Motion by Commissioner Brasted,
Second.
second by Commissioner West. Further discussions or questions about claims paid? Seeing none, this is a roll call vote.
Commissioner Brastad.
Aye.
Commissioner West. Aye. Commissioner Schulte.
Aye.
Commissioner Meisner. Aye. Commissioner Gamache.
Aye.
Commissioner Reiner.
Aye.
Commissioner Look.
Aye.
And that item passes. Next on our agenda is to approve the minutes from February 25th, 2020 County Board meeting. Is there a motion to approve?
So moved.
Motion by Commissioner Look. Is there a second?
Second.
Second by Commissioner Meisner. Any corrections, additions, or deletions? Seeing none, all those in favor, please signify by saying aye. Aye. Anyone opposed? And that passes unanimously. Next, we have two items under Chair's remarks today. For our first item, we are recognizing Anoka County Emergency Management Director Terry Stoltzman for receiving the Outstanding Community Partnership Award of Excellence from the Minnesota Department of Public Safety, Division of Homeland Security and Emergency Management. Commissioner Brasted, the chair of our Public Safety Committee, will tell us more about this acknowledgement. Commissioner Brasted.
Thank you, Mr. Chair. The mission of Anoka County Emergency Management Department is to promote the safety and well-being of the county's citizens through the coordination of this department with local, county, state, and federal partners. This effort is organized and overseen by our Emergency Management Director, Terry Stoltzman. The work Terry does every day to prepare for possible emergencies tends to be conducted behind the scenes. But that doesn't mean his contributions and leadership go unnoticed. Just recently, Terry was presented with an award from the Minnesota Department of Public Safety for initiatives that enhance emergency management. Terry was one of the first emergency managers to incorporate a drone program at the county level. This was important for the state in understanding the process and protocols needed for drones to be used locally. Terry also worked with the Department of Public Safety's incident management team to better integrate drone technology for emergency management purposes throughout the entire state. Terry has always been a forward thinker and can be counted on for contributing well-researched advice and consultation in new areas of emergency management. I'm now going to invite Terry to share some comments with us today about his award and the work in the field of emergency management. Terry.
Thank you, Mr. Chair and Commissioners. It's an honor and a privilege to work here in Anoka County. I do so for many reasons. I've been in public safety pretty much my entire career, and this is a great opportunity to continue that, tradition in my family in serving the public. Here in Anoka County, we do things a little bit differently because we are kind of innovative as part of our motto, and I continue that approach in everything we do in our department with emergency management. I've been here for just over 14 years. I'm in my 15th year of service here, and when I started, I was the first full-time emergency management director with no department, no office, no budget, and had to build from the ground up. And so I'm very proud of your contribution on behalf of myself to the board, all the staff that supported me developing the program, because that's why I received the award, quite honestly. It's reflective of the work we do in partnerships with all the other divisions and departments. I really want to thank my staff. Without them, both paid staff and volunteer staff, I have about 30 people on my staff. It started with just me, myself, and I. But we've grown and we've built a good framework for preparedness, response, recovery, and mitigation here in Anoka County. And I just want to again thank HSEM for this award. We do great work throughout the state of Minnesota. It all starts here in Anoka County, though. That basis is to make sure we have a good capability that we can bring to others if they're in need, either locally, regionally, statewide, or nationally. And that's why I received the award.
Well, Terry, thank you. And on behalf of my fellow commissioners, I have to tell you, we're all really proud of the work you do. I think we're lucky in Anoka County to have that level of expertise. We know and we've heard from our colleagues that you're respected across the state in the work you do, and probably well beyond the state. But it's I sleep better at night knowing you and your department do what you do. And it's an award that was well deserved. I'm glad you've received it. I'm sure there's many more to come. But while we have you here, could you take this opportunity to update us on the COVID-19 or coronavirus and explain what people can do at home, in the workplace, and at public venues to help protect themselves and mitigate the spread of this disease?
Mr. Chair, Commissioners, yes, I'd ask one of my colleagues to step up in case there's additional questions. First, I want to acknowledge I have a little pre-scripted so I get it right. One of the things, we just want to be very clear in our communication. I think that's the biggest thing with the public is getting clear communication from your government, from your leadership, to understand really how to deal with this at home. But really acknowledging the great work that public health and environmental services here in our own county, other county divisions and departments, they do every day planning for this event. Our colleagues at the Minnesota Department of Health and CDC and other state and federal level partners. And also really the first responders in our community and the medical establishment that provide medical care on a daily basis that is actually responding throughout the nation to this crisis right now. But we also want to make sure that we understand that all are essential for COVID-19, but the seasonal flu, the opioid crisis, and other challenges to our communities really need to be acknowledged. This is one of many things that we work on planning for, responding to, and recovering from throughout the year. And so this is one of the crises that we're dealing with right now at COVID-19. I'll give a little update. We have capability to respond to emergencies and disasters, and that's one thing the public does need to know. We have an established medical system. We have established central communications, our 911 system. We have ways of getting help to you, but we are in a little bit augmented reality if you've seen the things that are going on throughout the world over the last 3 months, and that's something to remember. This is a slow moving, not fast moving. This isn't like a wildland fire that you have to leave now. We have a little bit of time to plan. We have a little time to assess the information and remain calm, and that's what I would ask is people to be an informed consumer of information, understand and not overreact. We've seen the empty shelves at our stores for various commodities, including toilet paper and handy wipes and those things. Some people are hoarding, and that's unfortunate. We all just need to have just a deep breath and just understand that life is going to go on and just be prepared. So individual and family preparedness is one of those things I stress as the emergency management director every single day to people is take care of yourselves. Take care of family and look out for those around you and really just take the time. Hey, if you need some commodities, you need that extra flour that you think you might need to make your own bread, certainly do that, but don't hoard. There's no reason that we see to do that. One of the things that we look at is you can see, and for the public, if you will see online here, there's some things that you can do for everyday preventative practices. I'm going to ask my colleague from public health to kind of step up and kind of add. But there are a number of different things. Washing your hands is the biggest thing. These are used to do a lot of things in life, and so we frequently like to touch our face, touch other people, so it's okay to refrain from shaking hands right now to help eliminate the spread of just not only COVID-19, which there's only a couple cases in Minnesota and they're not in Anoka County. There's no reason for fear and panic, but just simple measures like that. Washing your hands, not touching, wash your hands for 20 seconds or more. Avoid touching your face, avoid touching, period at this time. It just, even the surfaces, it's cleaning surfaces as needed. We don't have to use a handy wipe every 5 minutes. We can use a 10% bleach solution. We can do some simple cleaning once or twice a day and be just fine. Higher traffic areas in our government center will get more attention through our facilities staff. But the everyday household cleaners are just fine for most of what's out there. And just cover coughs and sneezes, stay home if you're sick, are those simple messages that people need to reinforce It all starts with us. If we take these individual precautions and help eliminate the spread, it helps isolate it from our community, and hopefully it doesn't come beyond where it's already at. The two cases, as we know, are travel-oriented, and they do have quarantine measures in place. What that means for the public is basically if you've done that travel, you're going to get guidance from the Minnesota Department of Health and others to probably do a self-quarantine. It's more precautionary. The incubation period is 1 to 14 days. That's why it's 14 days, and you see the ones on the cruise ship are being deboarded right now and going to quarantine facilities. It's a little bit more of an extreme isolation measure, but we've seen that worldwide. You look at China, you look at Italy currently is on lockdown. We hope that it doesn't get to that point, but there are plans in place for that. How do we do social distancing? When they talk about lockdown, people are still going out to get commodities. They're still going out. If you look at Italy this morning, their coffee shops are still open. It's just vacant. Everybody has a little bit of fear, and they should have some understanding of what that means to them, and the distancing is appropriate for that measure. But communication's the key, and all communication starts. Talk to your family. I've talked to my family. I actually showed them a video last night. My wife's a nurse, and she learned some things, just understanding what this means. So she's a nurse in long-term care nursing home, which is one of the target areas. And so it's close to home. I have 2 kids, and so we want to make sure the messages stay sound and secure and understand what this means for them at school, abroad, and those. Additionally, I like to encourage people to be informed. So we have our website here in Anoka County has links to the CDC, Minnesota Department of Health, and ready.gov for that personal and family preparedness. So I encourage people to go there. We'll see what the future brings. Meaning, do we do more isolation and quarantine for certain individuals? Do we look at more extreme measures that'll come? We do have plans in place. And the big thing is, again, communication with that. I'll offer if you have any comments.
Well, I could certainly answer questions. So, good morning, Chairman and members of the board. My name is Susan Perkins, and I'm the Supervisor of Disease Prevention and Emergency Preparedness for Anoka County. And really, succinctly, we're maintaining situational awareness. So the Department of Health is having regular weekly calls for different entities. Local Public Health, the coalition, which we're a part of, which is hospital, EMS, emergency managers, and local public health. We have a coalition with the members in the metro, and we meet with them weekly. There are weekly calls for school nurses, public information officers, and long-term care, as well as the Minnesota Hospital Association. So we're just trying to maintain that situational awareness so we have correct messaging. And then messaging is really, at this point, the biggest tool that we have. And I just thank Communications Department for helping us set up that website. And because the information is evolving so quickly, we primarily have put links. There's some just really basic information, but we don't want someone to get yesterday's information today. The other thing that we're doing is working with our internal and external partners. We're speaking, whether it's with corrections or the police chiefs. We want to make sure that the messaging is consistent and correct, because we want that gives people a sense of security and support. And in the event that we did have cases, we're prepared and preparing more to provide essential services, which is a statute-driven requirement for local public health. So those are the things that our focus is on, and if you have any questions, I'd be glad to answer them.
Any questions for Susan? Commissioner Reiner.
Yes, we kind of know what the problem is, and well, actually the problem is still kind of identifying itself because it's evolving, but a lot of people ask me about the solution, and that's going to be prevention and treatment. And so I'm just wondering if you could share with us any progress in that area.
That's a great question. So what we have now, which is what you're hearing in the news and what you're hearing our messaging today, are what we call non-pharmaceutical interventions, right? Cover your cough, stay home when you're sick, wash your hands, keep your hands away from your face. And those are evidence-supported processes. We know that hand washing mitigates illness. I mean, that's evidence-based. That's just not like my grandma told me that, so I'm going to do it. That's evidence-based practice. But then as far as a vaccine goes, the most recent information I have is we're 18 to 24 months away from a vaccine, and that's if all goes really well. They do have some very limited amount of antiviral medication, but again, that's very limited and not well researched. Unfortunately, the majority of the cases have come out of China, and their transparency with us has been limited, so our information is limited. But those are great questions, but our focus is really on this non-pharmaceutical intervention, the social distancing, and good public health practice, because those are the tools we have in our toolbox right now.
Okay, thank you.
Well, seeing no further questions, I first of all want to thank you for your work and your entire team, your division. It seems like public health only comes to the forefront when there's a crisis. We know you're there working every single day because we see reports as commissioners, but the public doesn't always know what you do. And on behalf of all the commissioners, we really appreciate your work in that department and division and keeping Anoka County healthy and strong and moving forward. So thank you. And Terry, thank you and congratulations again on your award.
Mr. Chair, Commissioners, just one additional item for all of you and the public and for employees who may be watching. We've already taken action steps in this county. We've met a couple of different times with leadership and worked on those non-pharmaceutical interventions. And really, communication is the key through the communications department. The infographic you see on your screen, and all those have been posted throughout all the county buildings, and that's our desire is to communicate effectively throughout the entire county system. So our customers that come through the door for these essential services to them can be assured that we're continuing that message to all the employees, that they stay safe, that they have their customers, our citizens, stay safe. Washing your hands is our biggest thing that we can help communicate to those people that are coming through the door. Looking at our procedures, if we have to augment those, if we have to do isolation distances and so forth, just to make sure we keep ourselves safe, because we're the biggest asset, is us in the county for our staff. So thank you.
Thank you again, Terry. And that concludes item 1. For our second item under Chair's remarks today, we're recognizing the excellent work by our finance and central services staff, which led to the Government Finance Officers Association, known now as GFOA, awarding Anoka County a Certificate of Achievement in Financial Reporting for the county's comprehensive annual financial report, also known as the CAFR. I am now going to ask Commissioner Look, Chair of our county's Finance and Capital Improvement Committee, to tell us more about this award. Commissioner Look.
Thank you, Mr. Chair. The Certificate of Achievement that we're looking at here today is the highest form of recognition in governmental accounting and financial reporting. And its attainment represents a significant accomplishment by a government and its management. Our county is being recognized on this, and it is impressive because GFOA is composed of 20,000 members, and that's state, federal, and local government. And being at the top of this group, certainly in terms of accounting and financial reporting, is something to celebrate. And as chair of the Finance Committee, I can tell you that we have the best team in the business, and makes our job so much easier as commissioners when we go in and we receive financial information and direction and ideas on how to solve some of the challenges that we have. It's some of the best advice I think I've seen yet. So we have Corey Camp here, Manager of Finance and Central Services Division, to further explain the importance of this recognition. Corey?
All right. Thank you, Mr. Chair, Commissioner Look. Yeah, this is the highest recognition for in finance today, in government finance. This is actually our 32nd time receiving this award. So there's a lot of effort that goes in. I want to point out, especially Josh and Brenda lead the charge for our team. This is done with the whole team. We have many of our accountants and other managers and directors here who also participate. But Josh and Brenda put it all together, make sure the auditors get all the information they do. We also thank the departments that have to work with us on the audit and everything, but there's a lot of effort that goes in putting the information together. It kind of tells the financial story of Anoka County. There's a lot of required disclosures and stuff like that, and again, this can't be done without a team. So I think it's a great honor for us. We thank you for recognizing that, and we put a lot of effort into this because we too feel very strongly and committed to the finances for Anoka County and to make it being the best we can and providing the best information possible out there. So.
Well, thank you again, Corey, for providing information about the Certificate of Achievement Again, I'd like to commend our Finance and Central Services Division staff for the work they do every day to ensure Anoka County is on point with its accounting and financial reporting. Accuracy in this line of work is paramount, and our county is among the best when it comes to financial precision. I would just go on to say that it's a pleasure to sit on that committee. The stuff that comes before us, the information that comes before us is always a little bit enlightening. You learn a little bit more every day about how the county works and how it runs, and how just fiscally responsible Commissioner Look is as he oversees that committee with an iron fist. But with that, thank you again. Congratulations on the award, and we'll look forward to seeing one again next year. Thank you.
Thank you.
And now we'll move on to committee reports. Actually, before we do that, I'd like to recognize Supervisor Ed Kramer, who's in the audience from Linwood Township. Thank you for being here. Our relationship with our local municipalities is really important. We have a relatively short meeting today, so if you have some comments you'd like to offer us as an elected official, we would welcome you to the microphone now. If you're not interested in it, it's fine. You can just, all right, you can observe, and we'll continue on with our meeting. But do know our relationship with you as a supervisor is really important, along with all our city councilmen and everybody else we work for in the county. But elected officials have a special place in our heart. So thanks for being here, Ed. With that, we'll move on to committee reports, and now we'll go to the Management Committee report. Commissioner West.
Thank you, Mr. Chairman. All the items in my report are informational, and that concludes my report.
I like your report. Thank you, Commissioner West. And then we'll move to Commissioner Brasted with the Intergovernmental and Community Relations Committee's Chair Report.
Thank
Commissioner
you.
Brasted.
Thank you, Mr. Chair. The first item, I would recommend that the county board adopt resolution 2020-IZ04. It's a resolution accepting dedicated gifts for Anoka County Veteran Services. I'd like to specifically call out to the Ham Lake Lanes, Hidden Haven Country Club, Smoky's Pub and Grill, and EJ's, who participated in this event to raise money for our Veterans Office. And I'll offer that resolution.
The resolution's been offered. Is there any further discussion? Seeing none, this is a roll call vote.
Commissioner West.
Aye.
Commissioner Schulte.
Aye.
Commissioner Meisner.
Aye.
Commissioner Gamache.
Aye.
Commissioner Reinert.
Aye.
Commissioner Look.
Aye.
Commissioner Brastad.
Aye.
And that passes. Item 2.
I would recommend the county board adopt resolution 2020-IZ05, resolution in support of legislation to protect viability of volunteer driver programs in Minnesota. We have a very vibrant and busy volunteer organization that provides transportations in our county, and they are being faced with some challenges and barriers. One of them is that as a volunteer driver, they would not be placed in the same category as a for-hire transportation, like a Uber or a Lyft driver. So we want to support this legislation to help those volunteer drivers, and I'll offer that resolution.
The resolution has been offered. Is there further discussion? Seeing none, all those in favor, please signify by saying aye.
Aye.
Aye. Anyone opposed? And that will pass unanimously. Your next item.
I would recommend the county board adopt resolution 2020-IG06, Anoka County opposition to legislation that establishes watershed district spending requirements by political regions or boundaries. This is something that we also opposed last legislative session. Our concern is that any legislation could restrict watershed districts from spending outside of their area, where watershed districts really need to work together, and that would limit them. So I would be happy to offer that resolution as well.
The resolution has been offered. Is there further discussion? Commissioner Meisner, then Gamache.
Just a quick question around this. So yes, last year, I believe we sent a letter of support for opposition, a letter of opposition for this particular legislation. And Ramsey County as well also sent a letter of opposition back in April in 2019. So I'm just curious, are we the only county to now kind of move forward with an actual resolution, or do we know at all what Ramsey County is doing in terms of support for this?
I would turn to either Commissioner Brasted or Administrator Silveraja for that answer.
Thank you, Mr. Chairman, members of the County Board, Commissioner Meisner. I am not sure if Ramsey County is taking an action of passing a resolution, but our process internally is when we want something added to our legislative platform as far as support with others, that's the process that we use internally within Anoka County in order to do that. So that's why we're bringing this forward. Last session, it came up a little bit later, and the timing of our meeting did not allow us to have it go through this process. So thought it was prudent to do that at this point in time.
Thank you.
Thank you, Administrator Silveraja. And now Commissioner Gamache.
Thank you, Mr. Chair. Just to make sure, and this can be either Commissioner Brasted or Administrator Silveraja, that this is the same bill that we had talked about last year, I believe, and that it not only, that it also affects areas where, for example, the Rice Creek Watershed District is a primary example because it is in Anoka County, Washington County, and Ramsey County. And those three counties are all combined in that watershed. And I think some of the issues have come up from one of the counties that wanted to keep money that was raised within their county, keep that money spent in their county. I think that's also a part of this issue as well. So I would agree that the Watershed Act really does cover the entire area of the watershed, which can go over the boundaries, so it's a good policy to have, and I would support this House file and Senate file legislation because you spend your dollars to take care of the watershed. It doesn't matter if it's Anoka County, it doesn't matter if it's Ramsey, it doesn't matter if it's Washington. You need to make sure that the flow that runs all the way through is protected and being taken care of. So this is a good bill to support again in 2020. Thank you.
Oppose.
Oh, right.
We're opposing the legislation.
That's
This resolution is opposing the legislation that's proposed.
Right, because these two are the ones that
Right.
we're going to do that.
And to summarize what Commissioner Gamache just said is water doesn't know what county it's in. Water doesn't know what jurisdiction it's in. Watershed districts were formed for that reason, because we want to know where all the water is encapsulated, where it drains to, and then that entire area should be the jurisdiction. And this legislation attempts to usurp that by calling the water district the county district or the city district, and it doesn't make sense. So this is, again, this is in opposition of that legislation coming forward.
Thank you, Mr. Chair.
Commissioner Reiner.
You know, I guess I was going to say some of those comments that, you know, jurisdictionally I can understand, you know, the concerns of, you know, people being taxed and then those dollars not being used in their community. But you're right, watersheds they really don't follow jurisdictional boundaries. But, you know, there would be, I guess, some support on my part to have some kind of auditing function that would at least let people know how their dollars are being spent. Because, you know, it could be a situation where dollars are being unfairly spent. So, I mean, I don't think that the legislation includes that. It would be better, I guess, legislation to bring forward than what they're currently bringing forward. But I certainly do oppose the one that's being brought forward right now, which does say that dollars have to be spent jurisdictionally within the boundaries of where it's taxed, because it just doesn't make sense for watershed districts for all the reasons that you mentioned. But some kind of audit, I guess, would be a better legislative move on their part, I guess.
Thank you, Commissioner Reiner. The resolution is before us. More discussion. Commissioner Meisner.
Thank you, Mr. Just one more question about clarification. So this HF 2314 and SF 2372 was offered last year. It is not necessarily being offered this year. It could be, but we're simply opposing what's in the past bills. Do you see what I'm saying?
Administrator Silveraja.
Thank you, Mr. Chair, Commissioner Meisner. Because our legislature operates in a biennium, because it was introduced last year, it is still alive this year, so could be brought up at any point in time and quickly passed. So again, wanted to be proactive.
Thank you.
Thank you. Any further discussion? Seeing none, all those in favor of the resolution, please signify by saying aye.
Aye.
Anyone opposed? And the resolution is unanimously adopted.
And that concludes my report.
Thank you, Commissioner Breasted. With that, that does conclude our county board meeting, unless there's anything else to come before the board. Seeing none, we are adjourned. We will reconvene here in